Airway Device skill. The first thing we will do for this skill is gather our equipment. For this skill, we will need a stethoscope, the appropriate PPE, which will be gloves and eye protection, a BVM with reservoir bag and mask, oxygen tubing with an oxygen tank and regulator, airway adjuncts, a colorimetric device, a securing device, a suction canister with the appropriate catheters, and a supraglottic airway device. For this demonstration, I will be using the King Airway. Now that we've assembled our equipment and applied the appropriate PPE, we're going to prep our patient. The first thing we want to do is manually open the patient's airway and insert an oropharyngeal airway. After inserting the adjunct, we want to provide ventilations to our patient with our BVM at a rate of 10 to 12 breaths per minute with sufficient volume enough to see chest rise. I would continue to provide ventilations to my patient in order to pre-oxygenate them prior to the intubation. I would also attach a pulse oximeter to monitor their SpO2 readings. While my partner is pre-oxygenating my patient, I'm going to assemble my equipment. I've lubricated the distal end of the tube, and I've attached the 60 cc syringe to the tube. I'll now have my partner remove the oropharyngeal airway. I'll position the patient's head appropriately, perform the tongue-jaw lift, and insert the tube to the proper depth. Once inserted, I'll inflate the balloon with the proper volume and immediately remove the syringe. After removing the syringe, I'll attach the BVM to the tube and begin ventilating. I'll now have my partner take over ventilations so I can confirm placement by auscultation. After confirming the placement of our tube, we'll use a secondary device to confirm our tube. We'll attach the colorimetric device to the tube and then secure it. Once the tube is secured, I'll resume ventilations. We want to ventilate the patient at the appropriate rate and volume, as well as continue to monitor their capnography and SpO2 readings.